Hello, everybody, and thank you so much for joining us. I am Dara Carr with the Health Policy Plus project, and it is a great pleasure for us to share the results and recommendations from our work in sustainability planning with you. This presentation focuses on our efforts in Kenya over the past year, and I will just provide a quick introduction of the core team members, starting with Paula Bonio, who has led the work in Kenya for this activity, Christine Munene, who is a program officer with HP Plus, Stephen Mushiri, who is a senior advisor with the project, and I have been the global manager for this activity. This effort has had two work streams, one in Kenya and the other globally. In Kenya, we helped government actors both at the national and Mombasa County level to define and advance action items to enhance the sustainability of the family planning program. These efforts come at a particularly important juncture in Kenya as the government is going to be taking over funding for family planning commodities over the next few years. So Paul and Christine will talk about our work in much more detail, but I will say that we provided targeted technical assistance to government actors to produce analytics, to define priorities, and to engage effectively in budget and other processes to advance strategic aims. So we're going to be drawing on our experiences and lessons from Kenya, as well as experiences from other settings to develop a sustainability planning resource guide. And we envision that this guide will help facilitate efforts elsewhere to strengthen family planning sustainability. So from here, I would like to welcome my colleague Paul, who is going to talk about our efforts in Kenya at the national level in much more detail. Thank you. Over to you, Paul.
Thank you. So as Dara mentioned, the focus of this activity was to advance the sustainability agenda in family planning programming through working in close collaboration with the national government and the county level government in Kenya, build capacity of the key family planning actors within the government entities to make a strong case for increased domestic funding in family planning commodities at the national level, and then at the county level, strengthening capacity to better program and mainstream sustainability approaches in family planning implementation. We also focused on enhancing the capacity of these government actors in ensuring efficiencies in using the resources that are already allocated. So as I begin my presentation, I would like to start with a contextual overview in terms of the government prioritization of the family planning agenda in Kenya. The Ministry of Health in Kenya in around 2019 initiated discussions with the key actors or external actors, that is the donors in the family planning space. And the view of this discussion was to come up with a model that will progressively allow the donors to transition out of funding family planning as the government increases its commitment towards ensuring that we have 100% government funding for family planning commodities. So these discussions culminated into a memorandum of understanding that was signed between the Ministry of Health and the donors, and the key actors in these discussions were the USAID, the Bill and Melinda Gates Foundation, and the FCDO. And the MOU outlined a matching ratio that was progressively going to allow the government to increase its commitment to family planning through increases in budget allocation, as the donors reduced their funding commitments on a matching ratio over a 7-year period from 2019-2020 financial year to 2025-2026. So the government is expected to completely transition into funding family planning commodities by 2026, and donors will have transitioned out of funding family planning commodities. So as a start, we mapped out these ratios against the forecasting and quantification projections of resource requirements that are prepared by the Ministry of Health to find out what would be the dollar amount of the matching ratios that were agreed in the Ministry of Health. And what we found out is that for the government to meet its commitments to the MOU, they would have to significantly increase their allocation to family planning beginning 2020 to 2023 financial year, all the way to 2025-2026 financial year. Based on the government's commitment, the donors will put in a matching ratios according to what had been committed in the MOU. And this would mean that by the financial year 2024-2025, which is the expected final year of donor commitment or donor disbursements, we expect about 4.1 million US dollars. And then the government will have to commit about 21 million US dollars in the following financial year of 2025-2026. In terms of looking at the performance of this MOU, the completed financial year, that's 2021-2026, when all the donor commitment and the government allocations had already been realized. The MOU outlined that we were expecting donor a matching ratio of 1:1, where both government and donors each were going to commit about 7 million US dollars. But because of the COVID year, the COVID which affected government revenues, the government was able to raise about 5 million US dollars. The donors, on the other hand, put in 10 million to bridge the gap that was arising from the decreased revenues from the government side. Now going into specific approach of our support to this process. The advocacy support in the work we had with the government actors on family planning, we modeled it along the national budget cycle and to take advantage of the key dates within the budget cycle to push the family planning agenda and advocate for increased allocation in the next financial year's budget. The budget cycle is divided into 4 phases, and the first 3 phases basically we have the prioritization and determination of resource envelopes. This is where a lot of work goes in terms of ensuring the different programs secure budget allocation, increased budget allocation. And then after the prioritization and the determination of a resource envelope, we go to the next phase of the budget cycle where we prepare the budget estimates. So here the departments and the ministries set about preparing their itemized budgets, annual work plan, the procurement plan, preparing the cash flow projections. And then the third phase is the legislative approval. And then the final phase is the budget execution, which take place all throughout the financial year. So it's the outer cycle depicted there. So for the first phase, specifically what we did with the family planning actors at the national level, we supported preparation of family planning financial landscape analysis, which is a key input into the MTF process because this serves as an evidence piece for advocacy. It provides a factual basis for the leadership of the family planning department to engage with other key actors within the Ministry of Health and also with the National Treasury and the development partners. We also supported creation of internal briefers on family planning, which the department used to also facilitate engagements with the senior leadership of the ministry, and also supporting the actors to present this case that outlined in these briefs and the analysis during the resource allocation discussions in the sector working group that happened during the budget process. Then at the county level, we worked with the family planning team at the county level, together with the county health leadership, to define family planning activities and cost those activities to arrive at the funding needs. Then we also mentored the county health team to engage with the county treasury officials on allocation to family planning and also allocations to health in general. So that then the second phase, when during the preparation of the budget estimates, the itemized preparation of the budget estimates, we undertook a review of the national expenditures on family planning commodities and to identify bottlenecks that are causing the low absorption of family planning budget allocation, and then supporting preparation of a draft chapter with budget estimates for inclusion in the sector working group and the national budget estimates, which are then consolidated by the National Treasury before submission to Parliament for legislative action. Then at the county level in this phase, what we did was to work with the county during the health sector working group engagements and the MTF budget preparation process to create a family planning sub-program. So this we did through targeted engagements with the county health leadership and the county Treasury to redefine their program-based budget and establish a budget line that is specifically targeting family planning. And then also we supported development of a family planning implementation work plan for the financial year 2023. And in terms of some of the key results that we observed during this engagement, through our engagement and supporting the national team to engage effectively in the national budget process and resource sharing discussions, we saw the government increase its commitment by about 30% from 8.2 million US dollars in the current financial year, that's 2021-2022, to about 11.3 million US dollars in 2022-2023. So these ones are allocations that have been confirmed in the budget. The budget for 2022-2023 has been approved, and this allocation has been confirmed. However, on the other hand, we are projecting a decrease in commitments from donors based on the matching ratio. But as of March 2022, the total commitments that had been received from donors was about 4.6 million US dollars for 2022-2023. This ratio for donor commitment is expected to change as more and more donors come on board to pledge their commitments based on the MOU agreement. In terms of the next step that is focusing on enhancing efficiency in resource use, this focused on addressing some of the bottlenecks in absorption of allocated funds for family planning. So what we did here is to focus on identifying underlying issues on budget absorption, identifying alternative ways of mobilize resources for family planning, basically working with the government team to think through a benefits package for family planning that can be incorporated into the national social health insurance scheme that is being proposed under the universal health coverage policy, and then working with the government team to address issues of the governance around the MOU. The MOU was signed by the different partners, but the governance mechanism to ensure that the progressive commitments by donors are monitored and reported on has not been effective. The other issues also in terms of systemic issues that generally affect programming and utilization of family planning resources. So going into the specific what we did here, one thing we did was to examine family planning budget execution, identifying the major absorption issues, and also facilitating governance and leadership of family planning related activities. So during this discussion, what we had was what emerged was the approach that the family planning team at the national level takes when it comes to budget execution. There was always issues of delays in raising requisitions, and also when there's delay in raising requisition, it means that when the budget adjustments happen during the financial year, resources for family planning gets reallocated to other departments, because given the long procurement process and delayed requisition means that those resources will not be absorbed on time. What this resulted in is consistent low absorption, although there has been a bit of progress between the 2019, 2020 and 2020, 2021 financial year. The government still absorbed only 65% of the 863 million Kenya shillings that were allocated. So this means there was about 300 million Kenya shillings that was reallocated to other programs or was not utilized for family planning. However, as per our engagements that I described earlier, the government for 2021-2022 is on track to absorbing 100%. Because during our engagement at the budget preparation, we had the government commit to raising requisitions on time, and then that was followed up with an action that saw the transfer of funds for budgeted for family planning commodities being sent to KEMSA in two tranches, and that has led to like 100% commitment of those funds. So the government is on track to absorbing 100% budget for 2021-2022. So what some of the issues that I've described up there, in terms of the issues that are still pending on budget absorption side, what we are seeing is that there is not the regular reporting on execution of funds budgeted for family planning is still not there. So there's need to work with the Ministry of Health and the different partners to ensure that the government report to the partners on their commitment, not just on budget commitment, but also in terms of transferring those budgeted funds to KEMSA for onward procurement and distribution of commodity. The other issues on we also engaged in along to enhance budget execution, apart from highlighting the issues of absorption in government decision makers. We also fostered engagements between the Department of Family Health and the Ministry of Health leadership and Finance Department to ensure that the department receive technical support from the accountants in the finance unit of the department to monitor their budget and raise requisitions, or if there is opportunity for during the budget supplementary changes, if there's opportunity to increase budget or mobilize additional funding for family planning, that engagement will ensure that the department is on top of things and is able to work with the relevant entities to advocate during that window period. And then also promoting regular monitoring of family planning commodity resources with the DFH and the technical working group, that's commodity logistics. So these are an agenda that we have mainstreamed, and there's good uptake among a technical working group that is constituted from different partners to work on commodity logistics. There's quantification, monitoring commitments, and also the distribution of commodities. In terms of the other broader areas of family planning, we're looking at sustainability approaches in improving family planning coverage. So one thing is that we did here was to support the government team to examine the various options for expanding and sustaining family planning coverage. And we know that the government commitment and the government budget on one hand can only cater for a certain segment of the population, but there is that segment of the population that if the family planning benefits package is costed and mainstreamed in the insurance coverage, it would be much better monitored. So we worked with the Ministry of Health to initiate a discussion to have the benefits package for the social health insurance scheme expanded to include family planning services. However, this discussion we were not able to carry through, and it's a discussion that is still ongoing. And the different partners that are active in this space, uh, we expected that they will take up this conversation and push it forward. But in terms of technical approach, it is an opportunity for future technical support to focus specifically on supporting the costing identification of the family planning packages and costing of those packages, and then initiating and fostering discussions with the leadership of the National Health Insurance Scheme, the Ministry of Health, and the Department of Family Health, together with the different partners to push this agenda forward. The other broad area is on monitoring of family planning funding commitments. And this, as I hinted on earlier, will involve putting in mechanisms to ensure effective monitoring of the MOU commitment. Other key action points that we are proposing here is to consider a recourse in case MOU partner does not meet obligation. Currently, the MOU as signed does not have that put any obligation on partners in case or penalty in case any partner defaults. That needs to be addressed through future engagements and maybe revisions to the MOU to put in those clauses that can better ensure partners are committed. There's also need to engage the signatories of the MOU to discuss with the MOU signatories to ensure that they are fully engaged during the national MTF budget process and resource sharing discussions, because given their influence and commitments to this process, they can help put some weight into the advocacy agenda that the family planning actors at the Ministry of Health put forward whenever they are involved in the budget discussions and negotiations with the other departments. Other issue here is also to address the system level challenges. And the system level challenges here includes the procurement processes that are quite lengthy and bureaucratic. Sometimes, despite funds being transferred to KEMSA on time, there is a lot of delays in terms of the process itself of releasing the requesting of quotations, selection of the suppliers, we've seen situations where the procurement process take up to 4 months and contribute to stockouts of the family planning commodity downstream when you engage at the county level where the services are being provided. Then also there's need to examine the possible issues with family planning commodity market. Currently, there are few suppliers. Part of the reason why the selection or the procurement process take a lot of time is when KEMSA floats the quotation or request for bids, very few suppliers submit bids, and this leads to non-responsive bids. And as per the procurement laws in Kenya, there is a certain minimum that is required. And if you have an unresponsive bid, that means the process cannot move forward. There's also need to promote consistent release of cash flows by the National Treasury to support the family planning allocations. So sometimes the National Treasury here has restrictions on how funds that are budgeted for the different programs are released. For example, in Kenya, the Treasury has put a restriction that for funds for development are released in 2 batches. So the first half of the financial year, you can only access half of the budgeted funds, and also you have to wait for the second half of the financial year before you access the full funding. So sometimes what this means is that when you want to do bulk procurement for family planning commodities, accessing half of the money means that you are going to incur a lot in terms of distribution costs, which would have been much easier and you take advantage of economies of scale if you access your full funding and get more commodities for the dollar. From here, I would like to invite my colleague Christine to take us through the work that we did with the counties. Welcome, Christine. Take it over.
Thank you, Paul, for the elaborate presentation on sustainable planning for FP. I'll take you through the Mombasa HP Plus support towards sustainable financing and commodity security. The key issues affecting Mombasa County program is that Mombasa County did not have a family planning budget line item, which affects spending of budgetary resources directly. There's also been an issue of steep recent decline in family planning RH donor funding from US dollars 1.2 million in the financial year 2020-21 to USD 0.2 billion in financial year 21-22. There's also a decline in the number of women accessing modern contraceptives in the financial year 2019-20 to 2020-21. There's also been recent reports of frequent stockouts of preferred methods like injectables, where counties have mentioned not receiving commodities despite timely reporting and requesting, even though the status reports show that there are available commodities in the KEMSA stores. HP Plus supported Mombasa County by helping the reproductive health coordinator prioritize family planning interventions in the sector working group report and advocated for family planning budget line item. HP Plus also assisted in the identification and estimation of family planning activities in the financial year 22-23 budget and facilitated national and county dialogue to address the family planning commodity and logistic issues. HP Plus also supported Mombasa County to review the health budget for financial year 22-23 and prepared a matrix with the FP resource requirements and funding gap for the next fiscal year to advocate for increased resources. Through HP Plus technical assistance and capacity strengthening on FP financing and budgeting, Mombasa made the first budget allocation for family planning with domestic resources in 2022-23. Initially, Mombasa County allocated 1.4 million in the financial year 22-23, which later on they increased to 5.4 million Kenya shillings during the budgeting process. This first budget allocation in Mombasa County will support the county to implement family planning activities on commodity distribution, community mobilization, and demand creation. This matrix was developed by Mombasa County, which outlines the FP activities to be implemented in the financial year 22-23, and Mombasa County took a step further by identifying the funding gaps, which amounts to 3.9 million Kenya shillings, and this information will help the RH coordinator lobby for increased resources in the next financial year. As for the next steps on commodity security, Mombasa will review the national allocation tool for family planning commodities and adopt a standardized ordering tool, which was successfully implemented by other programs. There's also need to facilitate county participation in forecasting and quantification process. Mombasa County will initiate dialogue between USAID Afya Ugavi and Clinton Health Access Initiative to support the county in developing a family planning allocation tool to provide more accurate data on quantification. We encourage that the Department of Family Health to support KEMSA in tracking county reported data to avoid over and under supply of commodities. At this point, I'd like to invite my colleague Paul, who will take us through the way forward and next steps based on our shared experiences and lessons learned. Thank you.
Thank you, Christine, and thanks for highlighting the work at the county level. I'm going to take us through the next steps and way forward for this activity. So some of the key action items we would propose based on the implementation experience of this activity. First one would be to focus on strengthening the capacity of the county and national government staff to advance the family planning in budget processes. This is necessary as a matter of urgency because as the government agenda towards full domestic funding for family planning, for that to be realized, we need family planning to be promoted as a top priority agenda during the budget conversations. There's also need to institutionalize oversight of family planning procurement and resource use. Currently, these processes seems to be linked with each other. The procurement process and the resource allocation process are linked, and there is no forum for bringing this together or mechanism for bringing the conversations together to talk about how the inefficiencies in the procurement or delays in the procurement process lead to or undercut the agenda for increased allocation to family planning. There's also need to invest in capacity strengthening to improve data reliability, forecasting, and quantification. So the forecasting and quantification approach that is implemented currently relies on data being submitted to the KHIS, the system. Sometimes the data that's fed into the KHIS system comes from facilities, and sometimes the quality of data that facility feeds into that system is not very reliable, and then that leads to inaccurate quantification figures for the county. There's also need to deploy commodity information systems at facility level that is integrated with the national dashboard that will be managed by the Department of Family Health and KEMSA, and also need to foster discussions with the government leadership to address the gaps and opportunities for family planning commodity security. In terms of the next overall policy direction for family planning, and mainstreaming the sustainability agenda into those policy discussions, there's need to capitalize on the opportunities, the policy opportunities to sustain family planning. And currently, the government is developing a number of policies that touch on reproductive health. There's the reproductive health policy that the government has launched recently, and also the family planning policy that is in development. The government has also released the FP 2030 commitments, and some of these commitments, these are opportunities to ensure family planning agenda takes center stage in the discussions, policy discussions going forward. There's also need to mainstream family planning in all government sectors as a key development and planning consideration, and then developing robust data systems to enhance quantification and other supply chain efficiencies, and building collaborative approaches between the national and county level governments towards enhanced family planning financing. Then integrating family planning into the universal health coverage and the UHC benefit package and is also a matter of a priority. In terms of going forward and sharing the experiences, our implementation experience as described in this presentation, we are going to put this into a brief report that will be available on the HP Plus website. We're also going to foster understanding on issues and way forward as the country transitions away from donor support for family planning commodities. At this point, I would like to thank you. Thanks a lot for the support to be able to implement this activity.